My name's Dr. Matthew Williamson. I work at Capital Foot and Ankle here in Lincoln with Bryan Physician Network. Been with the practice since 2017 and love it. Being a regional specialist, any sort of foot or ankle issue is what we deal with, whether it's kind of a dermatology type issue or a fracture, an injury, or diabetes-related infections and wounds. So it's kind of a wide variety of people and pathology. It was a middle-aged guy that unfortunately was homeless, living on the streets. And during one of the cold spells this winter, got some frostbite on his foot. And I say foot because he only had one foot at that time. Years ago, he shared that he had got frostbite on the other side and actually lost his leg on the other side. After he healed up, we started to have conversations about moving forward, like what this means for walking, what we have to do to get him back on his feet. And along that conversation, realized that I hadn't really seen any prosthetic that he had, and he ended up sharing that he's basically been in a wheelchair for quite a while due to that prosthetic he had being broken. When he was picked up by EMS and needed to come to the hospital, he didn't share with them where his stuff was left, and so he didn't have it with him. A few days later, I had a free afternoon, decided I would just go over there for fun and see if I could find it, because that type of thing's kind of right down my alley. I knew I could fix it if we could just find this thing. Unfortunately, there was a lot of bushes, but after a while, was able to find where I thought it would be because there was a little path between a wall and the bushes, so ended up looking and found it. Throughout this whole process in our clinic, and this is kind of while we're in the hospital, while we're healing, our ped orthist in our clinic, Terry, was gracious enough to donate his time. He fabricated a kind of a custom orthotic with a toe filler, which means it's something we put in a shoe to allow him to walk with that foot, and it fills in the shoe where the amputation was. And our office manager, Duchess, was also gracious to allow our clinic to donate shoes to this gentleman. And so once that all came together, we're able to bring it all in, make sure everything fit good, and try and get him back walking and motivated to be active again. It's a big benefit of our practice moving over to Bryan Physician Network and not really being a private practice anymore, is that as doctors, we don't have to even pay attention to anything to do with insurance. You know, we just treat everybody the same and do what's needed. I think it's definitely something important, you know, that when you see even a small opportunity like that, to know that it's going to mean a lot to the person, you know, personally, if you can really help them out. Even just a small thing, you know, somebody that's in a rough spot, it can help them out a lot. When you see those little opportunities, take time out and do it.